So folks, it's 8 o'clock and welcome to the intersection. If you wouldn't mind keeping your eye on the icons for me to see when María Villagómez joins us, because she will be leading our conversation this morning. I'm going to give some announcement, but I'm letting just a few more people get on here. So what you're looking at on screen is the website, the place that you go to register for this year's Pathways to Hope Mental Wellness Conference, the best conference, freest conference that happens annually in San Antonio. It's at the Tobin, August 26th and 27th in person. I hope maybe you can see the link here, but Doug, would you please drop that link into chat?
It's there.
All righty, good deal. In case you don't know, At the Intersection is powered every week now, thank goodness, by sacred.org, the San Antonio Community Resource Directory. And it has helped me immensely and all of us to work smoother, but also to record our sessions. All of these At the Intersections are now being recorded, and you can go and watch those, point people to them. I know that somebody, for example, wanted to know where the link was on Bridges to Care and Mental Health, because they wanted to start that effort in their congregation and they were going to use the recording to do so. Billy, could you drop in the link for where people can find recordings of At the Intersection?
I just did it, Ann. The past meetings are posted at the link in the chat.
All right, good. I hope somebody is here from COPS Metro and ICANN. This evening, there is
And
a...
it looks like Maria is here.
Okay, good, thank you. This evening, there is, I don't know whether it's a community conversation or what they're calling it, but on gun violence that's being held at St. Francis of Assisi Catholic Church at 7 o'clock. If somebody is on this screen from ICANN or from COPS Metro, could you put those details into chat, please, for everyone? Also, the Express News is partnering with us and wanting faith and community leaders to write op-eds, 600 words or less. If you are interested in doing so, you can contact Tom Hager. He's with us this morning. Tom, could you drop your email into chat now? And I think that's my announcements, our announcements for this morning. If you have any other announcements that you want to share, just put those into chat if you would. The other thing before we get started, and I introduced Maria, I gave everyone some homework today. So I asked that you prepare before coming and be ready. I'm going to give you your homework now, I hope, in chat. And so your homework at least will be shared in chat. At most, it will be voiced, okay? So your homework, if I can make this go, is coming in chat, and I'm going to go over it rather quickly. It was 3 points to be shared with Maria and those who are working on the mental health funding from ARPA, American Rescue Plan Act. So to be prepared to give your insights about the process for determining how to discern and disperse these funds equitably and wisely. Insights about process. The second one, known mental health needs within the local community and congregational level. So that's like where you live and serve. Known mental health needs, and that's more than it needs help. You know, I don't know what that means. Counselors who are more culturally aware, give specific known mental health needs within the local community and congregational level. And then likewise, I guess there's 4 of these, known mental health resources, things that are happening within the local community and congregational level. Known resources, resources that you know that are happening locally in community, hopefully, you know, that are effective or could use some help. And I think what I just did here is I must have clicked it twice or something. So those are the 3 things. Insights about the process and how it would be best done. Insights about local needs, and insights known, actually, mental health resources that are local, okay? So at any time, you can put any of those into chat, concise. We don't want, you know, like this. It needs to be like statements, words. And we will save the chat and that will go to Maria and the folks who are working on it. So Maria, we come to you. So good to see you again. You are probably, besides the mayor, you are probably the one who has come most often to at the intersection. So it's good to have you here with us today.
Thank you.
And Maria asked if she could come back. And so that I find also very exciting, that there's value here within our work together. And so thank you for affirming that by asking to come back, Maria. That's very gracious of you. So I'm going to turn it over to you. Do you need the screen, or what do you plan to, how do you plan to engage us today?
Good morning, Ann, and good morning, everyone. And thank you so much for having me here. Don't need a screen today. I just want to briefly mention what the city is doing. I think most of you have heard my presentation through previous engagements. I see on the chat that there's some individuals that this is their first meeting. So I will give a quick overview of what we're doing. And as Ann mentioned, we would like to get your insights in the process that the city is following to disperse these funds, as well as your thoughts and your input about what we're doing with the American Rescue Plan Act, specifically the funds allocated to mental health. And just to mention, I have a couple of city peers here with me. Jessie Higgins is here. She is our mental health executive with our Metro Health Department. And I think Deirdre Johnson Murphy, I'm sorry, is here as well with Metro Health. So as you know, the city of San Antonio, as many other local governments, receive funds from the federal government to help us recover from the pandemic. And the city council allocated $26 million to mental health. So the city has been engaging with the community since October, November of last year to get priorities and the ability to carefully utilize these funds in an impactful way. So through that process and conversations with the council, this $26 million have been allocated. Our public safety committee that is chaired by Councilwoman Melissa Cabello-Habdra. She is leading the effort in creating an implementation plan on how to use the $26 million. So we had some initial ideas on how to do that. And we haven't allocated dollar amounts to these categories that I'm going to mention, but these are the input that I'm here to hear from you in terms of our priorities that we are thinking about, and then the dollars to be allocated to these areas. So in conversations with the council, and again, feedback from the community, we have identified areas that include providing assistance to our youth, to our seniors and our veterans as populations in our community where the conversation has been that we need to identify resources to help, again, our youth in schools, middle school, high school, helping our seniors that were heavily impacted by the pandemic, having more activities for them, also helping the caretakers, so some of our seniors that perhaps live with a mental illness, and providing that support to the care providers, family members, and others that are helping them out. And then for our veterans, those individuals that are experiencing homelessness, chronic homelessness, and how we can reach out to them and be able to connect them to services and housing. So that's one specific area. There's another area that the council is considering for the police department to respond to mental health calls in a different way. We created a team this fiscal year that includes a paramedic, a clinician, and a police officer that respond to mental health calls, but it's only one team in our entire city. So the council has expressed a desire to expand that team to continue that model. They've also talked about adding some dollars to help our first responders with their mental health needs, specifically our firefighters and our police officers. So that's the other category. And then the last category is we are wanting to have a better coordination of all of the systems that we have in place in our city to address mental health. So governmental entities, you have the county and you have the city of San Antonio trying to navigate through this space. We also have the Center for Healthcare Services, who's our mental health authority, navigating this space. And then we have many partners, our faith-based community, our nonprofit organizations, our service providers. So we are trying to figure out a way that we can align and coordinate our efforts to be more effective in our community. We also have identified the possibility to study what is the best phone number, if you will, to call in a pre-crisis and a crisis. So if somebody is experiencing a crisis, most of the time they call 911. We're thinking about maybe adding an option within the 911 system for mental health calls specifically. But also there are members of our community that need assistance navigating the many services that we have today. And we're thinking about perhaps having a separate line to be able to address that navigation and to help somebody who's either experiencing themselves mental health challenges or perhaps a loved one. And then finally, the last area is allocating some funds for a education campaign to reduce the stigma around mental health. So those are the areas that the city is focusing on. And again, we'd love to hear your feedback. Happy to answer any questions. In terms of where we are in our timeline, this feedback that we're gathering from our faith-based community, service providers, and the community at large, we're going to present that to the to the Public Safety Committee on August the 16th. The implementation plan that I described will be refined with what we're hearing from the community for their consideration and discussion on August 16th. If the Public Safety Committee feels comfortable with that implementation plan and approves it, it'll move forward to the full city council for consideration either late August or early September. So that's our timeline, just to give you some context in terms of how we're going to use the feedback that you're providing us and when we are planning to begin implementing the plan and spending the dollars that I described. So with that, that's my brief presentation, and Ann, happy to take any questions.
So I have a question that I'm going to start with, but and I thank you folks. I see people are entering things into chat. We are going to be using the hands up for people who want to speak, but we're going to use the reactions at the bottom. If you've not used that before, go to the bottom of your screen where it says reactions, click on that. and you'll see it says raise hand, and you click on that. And when you do that, then you pop up first into my screen and I can call on you. And then when you're done talking, you go back and you click on lower hand. So we're going to be using that for people who would like to speak out loud and have a conversation. So, but I want to start. I don't always have a question, but I do today. So Maria, a lot of the work that has been happening, not just at the intersection, but through like the faith-based initiative and Compassionate San Antonio, is a lot of, because it's my job, forming collaboratives around needs and work needs to be done, and then working together. In that work, and in the work that we talk about here at the intersection, same stuff, we really look at it as a system. So when we look at, say, the prevention of domestic violence, we look at the system and see how can we step forward, and maybe just by a simple tweak, doesn't mean it doesn't take a lot of work, but by some simple shift, it's going to transform the system so that the system is stronger than it was before and healthier. So that's what we're interested in. I can say pretty certainly that even before the pandemic, and I know organizations would say this as well, the mental health system of care that we have, not just in San Antonio, but in San Antonio, so that's where we're talking from, could use some tweaking of the system to better serve, right? That was to say it was like broken or total mess and wasn't helping people, because it does. But that even before the pandemic, it could have used some tweaking. So now here we are, this side, and there's this rise in mental health. How do you see this plan of rescue funds and that investment in terms of mental health and the parts that you've outlined? How do you see that it's tweaking the system overall in terms of mental health care to become healthier itself as a full system of care? Does that question make sense?
Yes, Anne, it does. And the way I see it, I think because of COVID-19 and what we have experienced, and with the dollars from the American Rescue Plan, in my opinion, mental health challenges in our community has been elevated to a different level. I think there's more awareness about mental health and consequences of not dealing with mental health in our society, from school, from adults, our seniors, and individuals that have experienced mental health issues prior to the pandemic. It just has been, COVID-19 made it more complicated. So the funds in COVID-19, I think, have elevated mental health to a different level. From the city's perspective, what we hope to achieve with these funds and that better coordinated approach is just the beginning of a longer term conversation about how we deal with mental health. For example, in the Metro Health Department, in their SA Forward plan, mental health is one of the priorities. We hired Jesse as somebody who's going to help us coordinate mental health programs within the city of San Antonio and be better organized and more impactful. So then we can partner with the county. We can better partner with you all, service providers, Center for Healthcare Services, to be more impactful. I think mental health, at least I can only speak for the city of San Antonio, it hadn't been on our priority radar as it is today.
I was also thinking of so I'm just going to use an example, but of the different directions you're focusing the money on. The last one comes quickly to mind because it was the last one, but just more education, the more aware that we are. We all know the impact of education. So I can see just that part alone, how that tweaks our current system and can shift it. The more people know about it, right, the better the system will be. So I'm just leaving that as an example that I can instantly begin to understand and see. I want to open this up to others who have questions or thoughts that they want to share. So please start raising hands. And I'm going to look. I don't know if there have been any questions in chat. Because I haven't been
No,
watching
but
that.
Anna has her hand up.
Okay, Anna. Thank you. Billy.
Hi, good morning.
Good morning.
I feel a little presumptuous, to be honest, raising my hand and speaking, being that this is my first time visiting the Zoom, but thank you for the invitation. I want to say that the information you shared is so encouraging, that there is an intentional effort with thought and funding and collaboration to work toward these needs. Just a tiny bit about who I am. I work for San Antonio Marriage Initiative. I won't give a big spiel on that, but we essentially believe that working in the preventative space, the prevention space, but also to meet the downstream needs as well, to strengthen every family, really strengthens all of society. We believe that the marriage is the leadership team of the home. If there is a marriage intact, and otherwise relationship help and resources is really critical for ensuring that all members of the home are healthy and moving out into society well. So all that to say, a little bit more about where I'm coming from. I have a master's in education. I've been in a classroom, first day of school. You can tell which children are coming from difficult situations and which ones are not. So I'm passionate about children and their health. We know that they are also the upstream of the impact of society. How the child goes also will impact homelessness and addiction and so many other things. I have a brother who's been homeless his entire life, and I have another brother who's been an addiction of some sort his entire life. And that all came from the breakdown of our family when we were young. So
Anna, your question, your thought?
Yeah, thank you. And I also have anxiety, so that I'm medically treated for. So the things you've talked about are so critically important, and I so appreciate this. I think what I wanted to ask, first of all, I think most of all, that education campaign that you talked about to reduce the stigma. That's something that I'm very open about with our mental health. That having been said, you mentioned the collaboration of organizations, nonprofits, in the government to work together. Is there any discussion how to essentially grow capacity, but in order to reduce dependency? So where the ultimate goal is not how many people we've served, but how many people have we served, but also moved out of these circumstances? And
I want to answer that first.
Okay.
So welcome, Anna,
Thank you.
for your first time here, but there's a huge collaborative that has been working on that for the last 5 years to build that capacity for both prevention as well as companioning. And you could probably watch one of our previous recordings on Bridges to Care.
I'm familiar.
So you
with
want to
Bridges
look
to
for
Care.
that. Billy, if you could put into chat again where she can find that link, or anybody could find the link to the recording. So that's a quick answer there, but those are cohorts of congregations and clinics and businesses and schools that are working in geographic proximity to the needs. So that's a quick answer. I hope that's okay, Maria, but there's a lot of, it's not the only thing that's happening, but there's a lot of that that's happening. So do you have another question or insight, Anna?
That's great. I've watched a presentation on Bridges to Care and great programs. San Antonio is so strong with collaboration and awesome thinking and innovation. So I guess I would just love to hear if there's an answer quite yet. This might be early. How is the best way to efficiently join hands of all the different organizations and people trying to streamline, do this together?
Well, again, out of that Bridges to Care work, there are several very large networks where you can join hands. So I'm going to connect you. And so he's on the screen here to Doug Beach, and he can help you get connected to some very large networks who are working together.
Thank
Is
you.
that okay, Doug? All righty. And he'll talk to you right now, I'm sure. While we have kind of a natural pause here, I want to encourage you to raise your hand. I want more conversation and more people being able to give input. But I am going to pause and kind of back up to welcome those that are new today at the intersection. Briefly, the intersection has been meeting since just a couple weeks after COVID hit here in San Antonio. We meet weekly, 8 to 8:30 is where we try within that time frame. We try to really give as much information as we can. We generally hang around for another 15 minutes of conversation if the conversation is still going strong. But the intersection is about faith and community and civic leaders working together, which that's the joining of hands that Anna was talking about. And we were really determined at the beginning of COVID that we were very aware that we had to join hands in that unknown space to be able to move forward at all, right? And out of this time together, so many collaboratives have grown and so much work has impacted the community. So this happens every Thursday, and we've been going for 2 years. The only Thursdays we didn't meet were Thanksgiving each year. And so again, we always pause about 8:30 to thank those who are with us, but do need to leave at 8:30. I always ask the briefer, Maria, will you have time to stay another 10 or 15, or do you need to leave?
I can stay another 10 and I have 8:45.
We will honor that. Next week, I'm going to give a heads up. Next week, we're going to be talking about resiliency hubs. And this is from our emergency management system here in San Antonio. With the rising needs that we have seen, hubs are being set up across the city, but they're also looking at congregations becoming resiliency hubs. And what that means is that when Snowvid hits and there needs to be sites where people can go, that congregation will be equipped and ready to help people in a resiliency hub, or well, just any of those kind of things that come up where we need to step up kind of our work that we're doing momentarily. I know, for example, that Christ Episcopal is looking at being set up as a resiliency hub. And so I'm pretty sure Justin plans to be here next week. So they want input. The emergency management system wants input from faith and community leaders. So I'll send out a notice, please try to attend and bring others next week to at the intersection. We now have 2 hands up. And Marie, if you would unmute.
I'm having all kinds of technology issues, so my internet may break up, but my question is on the 988 number, and you were talking about, Maria, about the about maybe having a new number. Would that be instead of 988? And can you explain how the current crisis call management, what the current process is? Because there was just an article about how it's not really handled in Bexar County and it goes out of county, et cetera. If you could talk about that a little bit, I'd appreciate it. Thank you.
Thank you, Ann. So I'll speak and I'm gonna caveat my response because I'm speaking just how the city of San Antonio does it. And I'll tell you a little bit about what I know, what other organizations are doing. But on a crisis call, when it comes to the 911 system, we have 3 options: police, fire, EMS. Depending on what the caller says, we route the call, and then the caller will get the information, and then we dispatch either a police officer to that call or a paramedic. As I mentioned, this year, beginning in April, we started a program, one team that is working in one of our substations that has a mental health clinician with the police officer and the paramedic to address mental health calls. We also have a mental health unit that is dispatched on certain 911 calls that are related to mental health. So that's how we are handling, the city of San Antonio is handling those emergency calls. The county has a similar team to the city with the three professionals that I mentioned. It's called the SMART team. I believe they may have a couple of teams and their process is similar to what I described to the city. The dispatcher at their 911 floor directs the call to the team. Now, outside the 911 system, my understanding is our Center for Healthcare Services has a crisis line where people can call, and then they dispatch those calls. Either some of those come to our 911 system if they believe they need a law enforcement component, and some of them they may handle themselves or they handle over the phone. I understand there are other warm lines perhaps for the pre-crisis calls if they need assistance navigating. And then now you have the 988 number that is brand new. And my understanding is that the call goes to 988. And I think the call center here in Texas that covers Bexar County is in Travis County. And Dog Beach may probably not knows this much better than I do, but they're the ones that dispatch the call to our Center for Healthcare Services. So what we're trying to study, we haven't made a decision, is can we leverage 988? How can we better utilize it? Should we add more clinicians on the 911 floor to take care of some of those calls that are coming in a different way without having to send an officer? Or do we work with existing entities that have a warm line already? So no decision made. We just want to put it out there for the council to say, yes, you can use some money, not a lot of money, to study that issue and come back with some recommendations. And of course, the goal would be to work with the community to figure out what would work best for all of us in terms of pre-crisis and then crisis.
Doug, did you want to add anything to that, or Jesse, that maybe Maria missed, or sounded pretty thorough to me?
988 is a work in progress. The way I've heard it described best is in Texas, it's a soft launch because there was no money that came from the legislature to implement the system. Our calls, as Maria said, do go out of the city, and that is and they also need to be on pre-crisis. They need to be directing people to local resources. And right now, I think that's challenging when the calls go out of the city. There's work to be done.
Okay, thank you, Doug. And we're going to take one more question, Maria, for you, and then honor your time. Friends, so from everybody wanting to know, who is this Lemonade Circle?
Hi, how are you doing? My name is Brandy Coleman, and I'm the founder and CEO of Lemonade Circle. And so we are a nonprofit organization. We empower young women of color in 5th and beyond to make a lemonade. And we do that through civic engagement, community outreach, and leadership development. You can look us up on all social media platforms. We have a website. We're about 96% African-American. We have about 70 young women all throughout San Antonio that attend all high schools, different things like that. I just wanted to know, I put in the chat about, a lot of my girls are super passionate, which I think a lot of kids are, about mental health. And so just kind of giving maybe a suggestion that is, we maybe could utilize our youth, and maybe, I know I just looked it up because I wanted to make sure that I wasn't speaking without doing my research. And I did see that we have a youth board commission, but I know several students would be willing, even college. I work at the University of Incarnate right now. Several of them would be willing to sit on a board or commission where maybe they can get like a small stipend. And just be able to serve as a resource at their school, and when I say I'm not asking them to be mental health, providers or anything like that. What we did last year was we passed out mental health boxes in collaboration with Valero. We created boxes that were had like fuzzy socks and candle and journal, just things to help you kind of get through the day. And we were able to get a lot of great, we did it to a couple of schools. We did about 200 or 300 of those boxes. And just kind of being able to serve as a resource at the schools using the students. I think that would be a great way of getting the kids to be more connected. A lot of them, and I'm just speaking on behalf of my girls, a lot of them do not feel that they have the support they need at the schools, just because, they're kids, they're teenagers. So they're wanting to be able to see people that look like them, that they can kind of go to and do things like that. Another suggestion I thought about was, again, using the students. They're super popular on TikTok, right? Letting them do a couple of TikToks. Some will have, big followers that kind of maybe, as the work is being done about the 988 number, understanding how they can use that resource. I would be willing to help. But I have girls that they make lemonade by serving on committees. So if y'all have committees and you want them to serve, and I know their parents would be willing to even to say, hey, on Thursdays from 8 to 8:30, I'll even be willing for you to miss a little bit of school, 30 minutes, so that you can have your voice be heard and make an impact in the city. So those are just some of the suggestions that I put in the chat, but I think it's really important that we engage the youth at the schools, especially now, and use them to our benefit, so that we know we can get a hands-on kind of idea of what is the immediate need, so we can have some boots on the ground. But thank you for inviting me to this meeting.
Thank you, Brandy. I'm assuming too, like maybe the different collaboratives that we have working, we could contact you, and it would be great to have Young Voices be an active part of those collaboratives. So
yes,
we'll all
they would
keep
love
that
it.
in mind.
They would
Yeah.
love it.
So Maria, do you have any last words while we honor your time frame? And you have our gratitude. Thank you for the work that you're doing, for coming this morning, but I don't know how you do it. I don't know how all of us do it actually in these times. It's a lot. It's a lot. So any last words?
Yes, thank you so much for having me. Please send us your feedback if you have any questions or comments. I know from the last gathering, I got a few emails. My email address is, and Ann can provide it. I won't.
I'll put it in chat right now.
That. And either email me or Jenny Higgins. As I said, we see this as the beginning of our work on mental health, and Jesse will be leading that effort. After we're done with this implementation plan, a lot of opportunities for us to work together, and we value your feedback and your insight. And please share with me how is the best way for the city of San Antonio to communicate with our community. In the past, you had given me some ideas that we have implemented to be able to communicate more effectively with you all, and to be sure that we're getting back to you on how we're using your feedback. So thank you so much, and have a wonderful day. Thank you so much, and appreciate you having me.
Thank you, Maria. Have a good day. So you're welcome to stay, you're welcome to leave, whatever you need to do. Too bad I couldn't make that rhyme. It's 8:39, and at 8:45, I will be closing this Zoom. So thoughts, and you could just open your mic and we can make this even more conversational if you would like, or things that you want to hear again that you didn't quite write down fast enough or something. Wow, the silent brood. Okay. I did want to share something that I've been doing, and I thought about it midway. I wish I had done it at the beginning, but I think it's since the 53 deaths of the folks in the semi truck. By the way, I understand that there's going to be a memorial service at the actual location. If somebody knows the details, I think was Lori Perry on here? I think yeah, there's Lori. It's coming out of the Archdiocese. Lori, do you have details? I just sidebarred in my own head. Lori, do you have details about that?
Morning, Ann. Yes, I have some details. I can put that in the chat. I'm blanking right now on
Seems
the
like
day.
it's like the 27th.
Right, at 8 a.m. or it's very early in the morning. And but let me look it up and I'll put it in the chat real quick. Okay.
I think I just saw that earlier, like this morning, and it also flew by my eyeballs, you know. So I'm glad to see that, because after that event happened, I was felt stronger as a community, because rather quickly there was a group that pulled together, and these were a lot of folks who are doing direct service with immigrants and refugees. They pulled together a prayer vigil at Pearsall Park. That was the first night. The second night, again, rather quickly, those folks among us, there's overlap, who do a lot of advocacy work. They pulled together a rally about this at Travis Park. And then the next evening at San Fernando, the Archdiocese pulled together memorial mass. So I was just really strengthened by how community came together. We've done that kind of thing that's been growing over the decades. I've been around and a part of these things for a couple decades now here, but to have that all happen in the short period of time it did, that was the first time that I had seen that happen. And at least for me, that spoke to the growing strength and connectivity within our community. So then when I saw briefly this morning fly down by my face that there was a similar gathering that was going to happen, but I think it's a month out at the location, that also I think is really important. And it was good to see. Anyway, I think it was after that where I started to dedicate my daily work every day. And as in the day after that happened, I dedicated my work that day to those lives that were lost. And then the next day, you know, each day I have selected to whom I'm dedicating my work. And I suppose if it's only meaningful to me, that's good, because it's meaningful to me, but I want to share it with you. It has helped me to focus my work even more. It doesn't mean that all my work that day was necessarily about immigration, but for other people, you know, that I could name, I've dedicated a day to my parents for particular reasons, and my own children. And today I am dedicating my day to the offspring of my grandchildren. Those are that I do not know. And so I'm offering you that as and invite you to join me in dedicating your days in those ways. It has for me made a slight shift, but an important shift in how I approach my work. Other thoughts, questions? It's 8:44. We probably have time for one more. And I'm not sure if Perry or Lori put anything in or not, but we'll get that information out to you. I really think it was July 27th off the top of my head, but I could be totally wrong. But I'll get that information out. Anything else for the good of the people? Billy, could you send me the link from just today, as well as the copy of the chat, so we can send that on to Maria and Deirdre and Jesse?
Absolutely.
Thank you. Lori, did you find out something?
I did. I found it finally. I had to search the website. It is Wednesday, July 27th, 8 a.m. that morning at the site.
Okay.
On, I can't remember the name of the road now, Quintana Road, maybe? No, I don't want to say the name of the road because I don't remember it, but
We'll still
Wednesday
get that out, but people can go ahead and mark your calendar.
yes.
And because that's, for me, that's the most important thing. Get it on your calendar. Next
Right.
Wednesday at 8 a.m.
Yes.
Okay.
Right.
So even if you can't go to the site, you can still mark your calendar next Wednesday at 8 a.m. and join in from wherever you are.
Yes.
And so I'll probably rededicate that day as well to the 53. So thank you so much. And we'll see you next week at the intersection where we're going to talk about resiliency hubs at congregational sites. Take care. Have great weekends. It's been great to see so many new faces today. Yay. Talk soon.
Bye, everyone.
Bye-bye.
Bye.